Welcome.
Hi, Pearl. So this is our presentation. Let me move things around here quick. Siksika Addictions Services. With this first page, what I'll do is I'll just get each of us to introduce ourselves and just letting everyone know who we are and what we do. I'll start with Craig.
Hi, my name is Craig Bearchief. I'm the senior case manager, and I oversee the 16-week matrix program as well.
And I'm Maria Reagan. I am a matrix facilitator, addictions counselor, and I mainly facilitate on family education, talking about addiction processes and stuff like that. And so that's what I do. I'm the family educator. Willie?
Hi, I'm Will Jerry. I'm the addiction counselor.
Willie, you're on mute.
Okay, can you hear me?
Can hear you now.
Okay. Hi, my name is Will Jerry. I'm the addiction counselor. I also facilitate, do one-on-ones and also send people to treatment. Yeah, there you go. Thank you.
Courtney?
Hi, I'm Courtney Jerry. I'm one of the addiction counselors. I facilitate Matrix as well. Same as what Willie said, I help people get into treatment, or even if they want to do one-to-one counseling. That's what I do. Thank you.
Merlin? Merlin, I think you're on mute.
It's having some technical difficulties.
Hold on.
Just want to come introduce yourself to my.
Can you hear me now?
Yep, we can hear you.
Okay. I'm Merlin Dorr. I'm addiction support worker, and I'm in charge of transportation, whoever's going to addiction treatment. I also take care of 6 trailers. So I'm the landlord for 6 trailers for detox, 2 pre-treatment, and 3 aftercare trailers. That's it.
Awesome, thank you. So is our priority is, this is the program overview, and our priority is to help Siksika members seek out the right help they may need. Examples is inpatient treatment, outpatient counseling in relation to alcohol or drug consumption abuse. So the inpatient is, the process of that is there's a whole referral process, but we'll probably talk about that a little later. And that's getting the clients, when the clients are referred to us, we would apply them to the different inpatient treatment centers that they might be interested in. Sometimes there is a longer treatment dates, and then there's some that are just quick stabilization type inpatient treatments. So we do that. We help the clients navigate what treatment center might be a best fit for them. And then we have our outpatient 16-week matrix outpatient program, and that one is all through Zoom and stuff like that. And then we also do the counseling in relation to alcohol or drug consumption and what all that looks like and stuff like that, like things that they may be experiencing, the processes of addiction, things that they might see with family members, because they're all in recovery. It's not just the individual, they're all in recovery and stuff like that. So within this program overview, we work with families, we can work with couples, individuals, the individual who's in recovery, we work with them, or we can even work with youth. Even we collaborate with other services such as the justice or family services or other social services, schools, or even nation members who reside in Calgary or other rural areas, or even we even had clients come in who are not members currently or not members as well. It doesn't really matter. We can see anybody. I'll get Craig to share that one, what we offer.
Okay, so what we offer is we have 6 trailers that we utilize. One is for detoxification. Clients can detox medically with the help of community paramedics. So detox can take anywhere from, as I was talking with the intake worker, Amanda, who couldn't be here today, could take 3 to 5 days to even up to 2 to 3 weeks, depending, I guess, on the client who was detoxing in that. So if, in case you never knew, just letting you know that through the nation and through the clinic side, it is offered through the CP community paramedics. So we also have 2 for pre-treatment. So those are clients who are awaiting treatment. So like say someone comes in that, and each case varies. So we have clients come in and they're in a predicament where they just don't have a place. If there's availability, they could qualify for the pre-treatment ones. And so within that time, we try to get the clients motivated into one of our matrix programs, or even our pre-matrix program, which we should be starting pretty soon. And what they do is they just stay there until they get their treatment date. And from there, they just head off to treatment. Then we have 3 for transitional housing. So this would be clients who come back from treatment and they may qualify for these trailers. Currently, we have one is who is actually awaiting to move into his own apartment. So it's also based on the availability of these places and that. Unfortunately, these are the ones we have, but just to let the community know these are available. The pre-matrix program is designed for clients and trailers or community members who are waiting for a treatment date. We have the 16-week matrix aftercare program. So the program runs Monday to Friday, 10 a.m. to 8 p.m. daily, and in the afternoons 2 p.m. to 4 p.m. Programs include, can't really see everything because the slide thing here is kind of blocking off, but we have, it's based on relapse prevention, early recovery, individual and conjoined sessions, group sessions, 12-step recovery, and we added the cultural component. So again, here, group session meetings, they happen every Tuesday eve, 6 p.m. to 8 p.m. This group is for present matrix clients who have completed 12 weeks from the 16-week aftercare matrix programs. Clients who have completed the 16-week program in the past can join as well. So that means like anyone who has completed the matrix program and that this program is available for them, the support program. And they talk about various topics like maybe Maria can elaborate on that a little more.
This is the social support. So with the social support, that is every Tuesday in the evening from, it's actually 7 p.m. to 9 p.m. And it pretty much, so we have the one topic and we discuss things along the lines of recovery and our mental health and stuff like that, and how we view things in relation to addiction with our mental health and stuff like that. And so that's what that is. And so it is about 2 hours. And like Craig mentioned, it's offered for those alumni participants who have completed the family education portion of the Matrix program. And then from 13 weeks and up, that's when we would work with the whole social support part and invite them. So I do that during the ones, the cohorts who are in one cycle, but then once they're finished the 16 weeks, so the last 4 weeks, I would do that with them with the last 4 weeks of the matrix, just to give them a tester of what the social support group may look like. And then after they're done, completed the 16-week matrix aftercare, I invite them to attend the evening group. So then they can attend the evening group as well. And that's on a weekly basis. So I'm not gonna make them attend every single day, Monday to Friday or anything like that. It's just on a weekly basis, every Tuesday at 7 to 9.
Okay, thank you, Maria.
Yeah.
We also offer the AA meeting. It's every Thursday, 7 to 8 p.m. These meetings follow the 12 steps in recovery. This meeting is for everyone who needs support during the week. To elaborate more on that, I'll just get Willie Jerry to, who is a lead for that, to speak more on that.
Again, the AA meeting, it's just your regular AA meeting, but we're doing it over Zoom right now. We go through 12 steps, you know, we do our parent circles, every typical AA meeting, and like most AA meetings, if you need a support letter or and all that, you know, I can just sign it for you. So yeah, come out, join our meetings, and go from there. Thank you.
All right, thanks, Willie. So we also got the family education support group. This is actually fairly new, where we don't have a tentative start date, but it gives information to the family members on what addiction is, based on the theory that it's a brain disease and etc., stuff like that. We do offer videos and stuff like that, and just help and bridge the community between families and people using to better understand and form a group where each family can support each other or even support other members. Due to the addictions and that, you know, we're all in it together and that. So do you want, Courtney, you want to go with this?
Okay. Turn down your. All right, so for the intake process, so assesses the need for medical attention within the next 24 to 48 hours. Assesses risk to self and others, risk factors, protective factors, ways to mitigate risk factors. Most of the time, number 1 and number 2 need to be completed at first contact, even if it's just a phone call, to get a sense of risks and offer a plan to mitigate them. Assesses addiction and client identified goals for treatment and change, assesses risk for relapse, assesses current psychosocial situation, assesses social supports and strengths. We also offer validation, supportive intervention, and education. So with naloxone training, harm reduction teachings, normalization and teaching about problems presented if they're open, willing. Also assesses other factors impacting their situation. So legal, child and family services, cognitive capacity and ability, and social, etc. Is there another slide for that, or is that the only one?
Okay, we could get Merlin to talk about the transportation part.
Okay, I'm, oh, mute. I'm the addiction transportation driver support worker who transports clients to treatment, clients' medical appointments, and other client transportation needs. Landlord for the detox and pre-treatment trailers. Mobile office van for clients who can't make it to the community wellness or no means of transportation. Mental health referrals available. Metro City referrals for Suboxone. I also transport those who need to go to Metro City. I also transport for any of the clients who need medical appointments other than Siksika here, if they're going to the city.
So for our referrals and not like the mental health referrals, it also means that once the intake process and that is happening, we can help the clients receive further help, like see a counselor or psychologist in case there's a dual diagnosis or stuff like that. Also with Metro City referrals for Suboxone, it's helping clients get on Suboxone for people who are dealing with opiate problems and that. And so what is usually done is there's a referral made to the medical side of the clinic and they help set up the people for the Suboxone to get on it and that.
Craig, you're on mute.
Did you miss all that? The
Yes.
other stuff about the Suboxone and that?
No.
No? Okay. So our contact info for intake and to apply for the 16-week matrix program, you can call 403-734-5687 and ask to speak with Vanessa Buckskin, who is our coordinator over the addictions team, or myself, Craig Bearchief, who is a senior case manager in the group.
Okay, thank you, Siksika Addictions team, for providing information to the community. If you have any more questions, we will go to the Q&A and I will stop recording. I just want to say thank you all for the hard work that you do. I know that you guys put a lot of hours and your heart really goes to helping our people. So I'll stop recording and then we will take any Q&A either through chat or you can unmute your mic and ask.